Грыжа позвоночника, операция делает, как это?
सर ओनली ब्रेन सर्जरी करते हैं या स्पाइन भी?
स्पाइन के बारे में बता देते हैं 5-10 मिनट। स्पाइन के लिए तो डॉक्टर राजन से को मिलवा दो।
जी он только нейрохирург, не позвоночник.
Хирург делает же.
Только голова он операция делает.
स्पाइन ट्यूमर्स के बारे में
Гидросефалия.
हाइड्रोसेफेलिया
हाइड्रोसेफलस वो सब बता देते हैं।
जी सर, जो सर्जरी सर आप मैक्सिमम करते हैं अक्सर.
So apart from the brain tumor surgeries, we do a lot of operations from hydrocephalus, which is excess water in the brain. We do two kinds of surgeries for hydrocephalus. One is the traditional VP shunt, in which we put a tube in the brain, and below the skin the tube comes into the tummy. Extra water from here is absorbed through the tummy root. We put a very special kind of shunt which is called as a programmable shunt. And the extra advantage of using this is that the pressure and the functioning of the shunt can be controlled non-invasively after the operation through a magnet. So through a magnet we can control the functioning of the shunt from the outside. The second kind of operation which we do for hydrocephalus is known as endoscopic third ventriculostomy. So that is an endoscopic surgery which we do for some special types of hydrocephalus, which is also very, very successful. Apart from brain tumor surgeries, we do a lot of surgeries for spinal tumors as well. So there are tumors which are inside the spinal cord. These days with intraoperative neurophysiologic monitoring, we can remove very, very difficult tumors which are inside the spinal cord. And also tumors which are pushing the spinal cord to one side. They are in the spinal canal, but they are not inside the spinal cord. So even those tumors which are pushing the spinal cord can be very safely removed through a very, very small opening in the spine through navigation and through microsurgery. So these are the different types of surgeries that we do, apart from treating patients with brain hemorrhage, treating patients with brain injury, spinal cord injury, and nerve injuries.
Гинди, эпилепсию как лечить? Операция делает, нет?
सर ये पूछ रहे हैं कि एपिलेप्सी एक डिजीज है, इसके लिए सिर्फ ऐसा सर्जरी होती है या सिर्फ ओपीडी बेसिस पे ट्रीटमेंट चलता है?
So epilepsy is a disease in which usually I will say 70 to 80% of the patients benefit by medical treatment. But 20% of patients, they are not controlled with a single medicine.
70% वो 70% नॉर्मल रास्ता है.
They need two medicines. Then 10% of patients are there who need 3 medicines. And even despite 3 medicines, the epilepsy is not getting controlled. So for these kind of patients, we do special testing which includes video EEG, and it includes a special MRI which we call as an epilepsy protocol MRI. After these two tests are done, we look at the reports and we can do epilepsy surgery for these 10% of patients who are not controlled even with 3 drugs, 3 anti-epileptic drugs. So for epilepsy surgery, the result is very good provided we have chosen the correct patient. So the patients that we do epilepsy surgery, more than 80% patients become free of seizures, and after 2-3 years we can even take away the medicines and the patient will be fine. So epilepsy surgery is a very, very valuable kind of operation and treatment that we do for the patient, and especially the epilepsy patients who are not controlled on 3 or 4 drugs.
Thank you.
Thank you, sir. Thank you so much.